I know we had a chat about things a few weeks ago, Nadia, but I want to talk to you today about a specific patient of yours. Josh Maddox?
That boy. He really is a very big problem. A difficult child. His mother has no control. Where I come
Yes,
from...
well, we received a letter from his father today, in which he accuses you of intimidating behaviour and reducing his son to tears. He also states that his son is normally cooperative and compliant by nature. It seems he feels that you've used your position to abuse a vulnerable child, and now he wants a full explanation as to what happened.
I see. Do you know how much time and effort I have put into that boy's treatment? And for what? For nothing, that's what. I can explain everything very clearly to his father. I have everything very well documented. His brace was broken for the 3rd time, so I've decided to debond him. And his oral hygiene appalling. I could see no point at all in continuing. In my opinion, it was in the best interest of the boy.
Yes, I know it was all well documented. But Mr. Maddox is particularly concerned that Josh's mother was kept outside and not consulted before you debonded him. Now, I've spoken to Sam, and she confirms this.
I usually find children behave very much better when their parents are kept out of the way.
The thing is, Nadia, discontinuing of treatment requires the patient's consent. Now, a parent can give consent, but if a child is seen to be Gillick competent, and it seems that Josh Maddox is, then his view needs to be taken into consideration too.
He didn't have any interest in this treatment. No commitment. Okay. So I made a mistake. These things can happen.
Well, obviously, if Mr. Maddox wants to take this matter further, we'll do our best to support you. But you will need to contact your defence organisation for advice. And you will need to respond personally to this complaint.
I see.
I know how difficult some of your patients are, Nadia, and how it isn't easy to make them play their part during treatment, but we need to find a few things that you can do from your side to help things go more smoothly, for your benefit. This isn't the first time you've had negative feedback.
You know, you just try to do your best, and you come up against so much rudeness. And some of these parents, they don't know how to be good parents. In this country, children are the boss. I can't believe it sometimes. It's ridiculous.
I know what you mean. But these people are our patients. We have to do what we can to make sure they're happy. Now, I'm not an expert on children. But in my experience, the more you tell a child what to do, the less likely they are to do it. I've got a friend. He's got 5 children. Now, he's come up with an effective strategy. Any time he wants them to cooperate with him on something, he lets them think it was their idea. It's quite clever, really.
I do know what you're talking about. I do have a degree in psychology.
What I'm really trying to say is, I just think you could be gentler with your patients and their parents. I find it useful sometimes just to get to know them a little, make more contact with them, whilst maintaining professionalism, of course. You see, at this practice, we've got a reputation for being a friendly place, welcoming families. And you know, in my view, family relationships are there for the long term. Retaining family members as they grow up. It's not just about a one-off course of treatment with no consequences. You know, Nadia, I would hate to lose you, because you really are an excellent clinician. But it's taken us years to build up our reputation here at Briar Patch. And it's a reputation that could be lost in seconds. Word spreads fast.
Of course I understand what you're saying, but I'm always on such a tight schedule. I'm not sure how I would build this sort of time into my appointments. I will give it a thought. I need to do something, though, to make my work more rewarding. It's so much bad feelings from patients. It's upsetting. I don't mean to be impatient, but sometimes I just get so frustrated.
Yes, well, I'm sure we can work out something together. Let's meet up again in 2 weeks' time, and if you need to have a chat, feel free to give me a ring. You've got my mobile number, haven't you?
Yes, I have, okay.
Nadia, try and have some fun. I get the feeling you don't have too much fun. You know what they say? All work and no play.
Which makes Nadia a dull girl.